Hey guys, Dr. Osgood here with Grassroots Functional Medicine. I hope everybody is doing well. I wanted to follow up on last week's webinar, the Autoimmune Infection Connection, and talk to you about what is possible by taking a root cause approach. I wanted to present a case study of a woman who has really worked her tail off to get where she is today. She has been struggling for many, many years and is finally seeing resolution. But her story is a great representation of just how complex autoimmune can be, or infections can be. And I hope you find value in this and get a better understanding of really what is possible. So this young lady, her name is Jennifer, and we're going to call her Jennifer anyway. Jennifer is a 48-year-old female who was coming into the clinic because she had been diagnosed with fibromyalgia. She had been diagnosed with chronic pain syndrome, and she was also diagnosed with chronic fatigue syndrome. So a lot of diagnoses, and this was just a few that she had on her chart, without a lot of explanation into why these things are happening. So one of the things that I just wanted to share with you real quick about her, this really caught me. We have people fill out a pretty comprehensive set of paperwork before they come into the clinic, so we really can get a good understanding of where they're at and what their goals are, in addition to the discovery call that we have, where I talk to them directly before their appointment. But she said in her paperwork, I thought this was pretty intense and pretty revealing of really how much she's been struggling and how much she wants to get this under control. She said, I really just want to be present, loving, and supportive while teaching my kids, and right now my symptoms are keeping me from being the mother and the teacher that I need to be for them. So she was really trying to get her health under control so she could be in a better place for her four children and for her husband and for her family. And she knew, because of her poor health and how she was feeling, she wasn't achieving the presence in her day-to-day that she really wanted to. And I see this so much in the clinic, and it makes you think, why is health so important? What are we doing? Why are we even working this hard to achieve optimal wellness? And this is a perfect example. It's not for yourself. It's not selfishness. Oftentimes it is your family and your loved ones and what you can provide for them that is the driving factor that gets you to do the things you need to do to get healthy. So she started our adaptation program, and I'd just like to show you this chart to kind of walk you through how our program is outlined. So the first step is the investigate and triage, is where we do a deep dive into the history. The first appointment with myself is about 2 hours long. We go over everything from birth up until present day, looking for looking at symptoms, looking at nutrition, looking at what we call antecedents or triggers that can predispose people to having problems. Then we evaluate, any lab work that we have ordered or any direction that we have given, and we take action. We take action by formulating a plan that's individualized, and then throughout the process, we're constantly reevaluating and adjusting and tweaking so we can optimize the outcome. So let's start with the investigate and triage phase. So again, this really starts before the visit with all of the comprehensive paperwork and the forms that people fill out outlining their health history, and this is extremely important. But just as an overview of her case, she was experiencing debilitating fatigue. She had extreme anxiety and depression, horrible joint pain and muscle aches, and she was constantly getting sick. And one of the things with her is she had immune issues since childbirth. She had frequent strep, frequent ear infections. She was constantly treated with antibiotics. She has anxiety as a child. She had strep as a child. She had strep, and anxiety in high school, and even in college. She had a couple of other pertinent pieces of information as she traveled overseas. So there's question about something, whether or not she could have caught something in her travels. She had mono in college, but actually was diagnosed on 2 separate occasions after that first diagnosis with mono again. In college is really where things started to take a turn for worse. She got really fatigued and had a lot of joint aches and pains, and was diagnosed at that point with chronic fatigue. She also noted at that time, or soon after college, things just continued to progress. She started to notice that she was starting to become sensitive to everything. Her, chemicals in the environment, chemicals in stores, the smell of perfumes would drive her nuts and set her off to have a migraine or just feel miserable. And we also pinpointed just another thing to discuss is after college in her home, one of the other big problems that we picked up from her story and from her intake is that she had done a lot of the flea bombs. She'd been exposed to a lot of those chemicals from flea bombs. She had problems with fleas in her house. So there's the chemical piece, and then there's the question of the flea piece. Could she have been, could something have been transmitted from the fleas itself? So 1992, which is right after, she had the problem with the fleas, she really started developing worsening chronic pain and the chronic fatigue and the fibro. She had, a little bit later on in life, again, as things progressed, she had really bad anxiety and racing thoughts that she could not get under control. One key piece we picked up from her history was that she actually was treated for a sinus infection on multiple occasions with antibiotics, and her racing thoughts and her mindset seemed to improve. Her cognitive function seemed to improve while she was being treated with the antibiotics, which is interesting. She's had a lot of antibiotics throughout her history. We worry about the impact that has on her gut, but she did notice clinical improvement. She also, again, allergies became horrible, unbearable, and get more and more environmental allergies started, and issues started to pop up. She actually mentioned that she lived near a racetrack. Every weekend when they had the races, you could smell the rubber from the tires, and that would just drive her body, insane. It would throw all of her symptoms through the roof. So very, very chemical sensitive, which in my mind tells me there's a big problem with detoxification, and something is driving, a lot of inflammation in her body. So as you can see, based on her clinical symptoms, so for those of you who haven't seen these before, this is a medical symptom questionnaire. We have our patients fill this out at the beginning of each visit, and this was her initial questionnaire. So they rate their symptoms for various body systems. This is just a small sample of the form with the total score at the end, from 0 being no symptoms to 4 being severe. And her total symptom score was 126. Anything over 50 is really considered pretty toxic. So we know she is really feeling a lot of discomfort and a lot of symptoms. So what do we do? So we did comprehensive testing, a whole host of different tests that I will explain to you here in a minute. And we started her on an anti-inflammatory diet right out of the door. And the reason we do this is because it's very, very effective at lowering inflammation. And we also focused on detoxification. We put her on a detox, a gentle detox. She started coming to the clinic and doing infrared sauna therapies on a routine basis, and really just hit the ground running. So what do we find? So initially in the blood work, at that first follow-up, we went over all of her labs. She had a lot of inflammation in her body. Her CRP was at 4, almost 5. So this is telling me systemically she's got some inflammation, which is not uncommon with autoimmune or fibromyalgia. And then SED rate was also high at 29. And the other thing we saw here was her eosinophil count was high. Now, if you remember from the webinar, eosinophils are one of the ways we detect whether or not the immune system could be activated for a parasite infection. So right away, just seeing that, it makes me think that, hey, is there a potential parasite issue here, or is this just related to environmental allergies? Either could be the case. So we did a comprehensive stool test, though, right from the get-go, luckily, so we didn't have to wait for this. And lo and behold, she did have a parasite. So right away, we're thinking, hey, this parasite could be contributing some inflammation, which could be, again, exacerbating all of her symptoms. And then we also found in her organic acid test that she had a bacterial overgrowth, which explains a lot of the digestive symptoms that she was having, the bloating, the gas. She's having some issues with regular bowel movements as well. So after her first a couple of follow-ups, before we even implemented the treatments for the testing that came back, what we found is that her symptoms had actually improved pretty dramatically just with the diet and detox alone. Her symptom tracker went from 126 down to 75. And that's the point where we started her on some antimicrobial therapy and supported her nutrition for her deficiencies based on the testing. So she was feeling better just with diet and detox alone, but she wasn't anywhere near where she needed to be. So we started her on the antimicrobial therapy, antiparasitic and antibacterial based on the lab findings. So first off, she started with the antimicrobials, the antibacterials, which do have some antiparasitic effects, but was mainly geared towards the SIBO just to try to get her digestive symptoms under control. And she felt better on that. But when she added in the specific antiparasitic therapy, she actually had an onset of new neurological symptoms. And I mentioned this in the webinar. Sometimes as you treat bugs, you can provoke other symptoms. And this is exactly what happened with her and why I wanted to share this. She actually started having dizzy spells and just feeling kind of off balance after we treated her for that parasite. So was it the herbs activating something else? Was it the parasite having a protective effect? It's really hard to say for sure, in all honesty, but those dizzy spells definitely woke something, or the antiparasitic therapy definitely woke something up. Now, overall, her symptoms were improving still. She went from 75 down to 56 on her symptom tracker, but this new set of dizzy spells told us something was missing. So what I did is I did further testing, and so you can see here, based on her symptoms, we wanted to look for some of those infections other than parasites that could be triggering some imbalances. So we found her anti-streptolysin O was elevated, and this is telling us that, again, there's more of a chronic strep issue going on. She's had a lot of exposure to strep throughout the year. She's got 4 kids too, but again, we know strep can be problematic with causing issues with neurologic dysfunction. We see that with pandas, for example, which is an autoimmune encephalitis. I think I mentioned that in the webinar as well. And adults can have this too. So a lot of the anxiety and the depression and the neurological symptoms can stem from that. So she had strep being high as an adult, but she also had some immune reactive bands for Lyme disease. And she lives in an environment where she has a lot of exposure to ticks. She doesn't remember ever having Lyme disease, although she has been bit in the past. But she did have immune reactivity against this. Now, this isn't CDC positive Lyme, but we also need to remember that the criteria for Lyme disease from a lab testing standpoint that the CDC puts out is not for diagnosis, it's for epidemiologic studies. So Lyme disease is a big problem in our society, and her symptoms, the reason we did this is not because we were just fishing. She had symptoms that matched up with Lyme disease. And I'm not one to throw the Lyme disease diagnosis out willy-nilly because, a lot of people I feel do that, and they treat everything like it's Lyme. You want to have some good testing to back it up. But here we're seeing there was some reactivity. And then to confirm, what we did is we did a CD57 test. And this is an immune test. This is a natural killer test. So your natural killer cells are part of your immune response. And oftentimes with chronic infections and Lyme disease specifically, we'll see this low. It should be, at 100, 150 plus, and she was at 20, showing her immune system is definitely not very hardy. And again, it kind of coincides with that Lyme presentation. Or co-infections. Again, co-infections are another thing that can be problematic. She fit the bill for Bartonella. We didn't do a comprehensive set of testing for Bartonella for financial reasons, but clinically her symptoms with the dizziness and the neurological issues do fit Bartonella as well. So what did we do? So because she, wasn't really making the progress that we wanted her to at that time, she was having some pretty intense neurological symptoms. She was testing positive for Lyme and having clinically presenting like she had some potential issue with Bartonella. We started her on antibiotic therapy. And this is not something I just throw out willy-nilly either. I have an extensive conversation with my patients, and then we try to figure out what is going to be the best plan of action. Do we want to go for a more natural herbal approach? Do we want to be aggressive with the antibiotics? And because of where she at and how this was impacting her life and the positive influence that she'd seen with antibiotics in the past, remember that I mentioned before, she felt better when she was treating her sinus infections, we decided to take this next step. So we started her on actually dual antibiotics. We started her on an intracellular antibiotic that has some effectiveness against both Lyme and Bartonella, and a cystic antibiotic that works on cystic forms of Lyme, and it also helped. It has been used as an anti-malarial and in various autoimmune issues. So that combo together, we used that, and we started her on that, and her symptoms immediately started to improve. And while we did the antibiotics, we also supported her gut and focused on detox. And it was just amazing to see, the progress she made, again, in a short period of time. So her dizzy spells went away. She started tolerating foods better. So again, she was very reactive to foods, very reactive to her environment. And after treating her for this infection, her foods and her environmental reactions seemed to dissipate. Another thing I mentioned before, and it may be related to the strep piece, is in the antibiotic we used covered strep as well. The tonsils, she had huge tonsils that were swollen for as long as she can remember. They wouldn't dissipate. And, after working on the diet, working on detox and combating these infections, her tonsils actually improved to normal, which she doesn't even remember the last time that happened. But again, these are all subtle symptoms that the body is experiencing inflammation, and something is out of balance. So this is her current MSQ. I just saw her a couple weeks ago. She went from, as a reminder here, she went from a 100 and I think she was in the 120 range, 126 if I remember right, to now being at 21. So she went from being, feeling toxic to feeling really pretty good. Now this is always a work in progress. We actually transitioned her off after 3 months off of the antibiotics, and now she's doing some antimicrobials or natural herbal therapies for Lyme specifically, and she is doing really, really well. So this was a great example of just how complex, dealing with immune issues and infections can be, how there's no perfect recipe, but you got to work with your practitioner and you got to partner with them and figure out what's the best step to get you to where you need to be. There's never one thing that is causing all your symptoms. You have to take a very comprehensive approach and look at multiple angles, because that is what is going to get you to where you need to be. So, again, if this is something that you're interested in, look at our adaptation program. If you're ready to make changes in your lifestyle and really dive deep into your physiology and your history and what's going on in your environment, that is what we do. We try to support you on multiple levels: mindset, nutrition, stress, and then obviously the physical and infectious and toxic components. We have to look at all of those factors because they all need to be addressed to get you to where you need to be. As a reminder, we do offer right now 100% telemedicine consults for anybody who resides in New Hampshire, Vermont, or Texas. This is a great way to continue your journey or to initiate your health journey while being at home right now. I know everybody's stuck at home, but you just don't want to let your health go to the wayside. You can still do a lot. In fact, a lot of people are able to do more now that they have the time and energy to focus in on their state of wellness. Because just like this woman, she wanted to be there. She wanted to be present for her family. She wanted to be present for her children and for her husband and for her friends. And that's where we all should be. So again, if you're interested, just go to our website, grassrootsfunctionalmedicine.com. If you go to grassrootsfunctionalmedicine.com/get started, you can book a free discovery call. This is a call I like to talk to all of our patients before they become a patient and learn about their goals and figure out what they've done, and just make sure that we are going to be a good fit for them and they're going to be a good fit for us. We're looking for the right people, not all people. Because it really does matter to me that you get good results. And I know a lot of people are thrown from doctor to doctor and given diagnosis to after diagnosis, but it doesn't have to be that way. So check out our website, watch the videos. There's lots of free educational information on there too. And if you have any questions, feel free to let us know. Have a great day, guys, and thank you so much for watching.